I'm Roxanne Durhodge, and I'm a psychotherapist, and I've been in the field of psychotherapy for over 20 years. So, what I thought about was, what have I done in my career and how could I be helpful? Well, my career has spanned lots of different environments, and if there's crises, oftentimes most of us may not know how to cope with those. So that's something that I worked with a fair amount with the Metro Toronto Police, where I would respond to, when there had just been a crime, for instance, and I would assist the victims and their families. So again, if there's ever an issue of that nature, it's something that I've worked a lot with. Another issue that is something unfortunate that I had the opportunity to work with was addictions, where I ran an outpatient clinic for well over 10 years. So again, addictions is something, unfortunately, that plagues a lot of people and families, and the impact on families. It's quite difficult, whether it's alcohol or drugs, gambling, or an eating disorder. Again, oftentimes most people don't know what to do with it, and it's quite crippling to the individual and those around them. That's something that I've worked a lot with and continue to do a fair amount with. Presently, I work a lot with companies where I consult with some of their health and wellness concerns. So if you think of different environments, right, different environments have their stressors, whether it's a 24/7 service, like a hospital environment, which I've worked a lot with, or a financial institution. If you think about our economy and the impact of people's financial lives, and think of the stressors in those environments for those employees. So I've consulted a lot over my career with companies about what is effective based on what the stressors are with employees. So that is something that I also do. And how do you also assist managers who are having to cope effectively with those employees who are having difficult times? Trauma is also something that I work with and continue to work with today in my present private practice. So trauma, and I often say it's either the, small t trauma or the big T trauma. So whether it's, I had difficulties with my parents when I was young, or I've had some really horrendous traumatic things happen to me in my life, and it impacts my ability to trust or relate or connect or be in relationship with others. That unfortunately is a tough thing, but again, that is something that I have worked with, but I continue to work with today. So overall, I think people come to me when there are concerns, be they small or big, and if that's something that you can relate, that maybe yourself or a family member or someone in your community is dealing with and you're needing assistance, you can reach out and we can chat a little bit further about it.